So moving on to the HDU, so that's where the previous video left off. So just being transferred from the ICU to the HDU, so the High Dependency Unit. I had my own side room, which was brilliant. They wheeled me in there with all of my machines, came with me from the ICU. Also all the monitors, the drips, the heparin drip, which would become my best friend, my worst enemy. I had to wheel that thing around for days, it felt like. So all of that came with me. There was a whole team of people when I first got moved into the HDU, all buzzing around, all setting everything up, setting the machines up, and then doing a handover. And it's quite weird because you're lying there, and they're talking about you. They do ask you some questions, but it's ICU to HDU nurses. They're talking to do the handover, what medication you're on, when you last had ops done, all of this, that, and the other is all going on. So it's all a bit of a whirlwind, really. And you're sort of lying there, and I remember the room feeling really, really small because I was in a huge hospital bed. I had, all these machines behind me, all these people here. My family were kind of in the corner. I was thinking, how can all these people fit in this room? It just seemed tiny. But obviously, as I sort of got up and out of bed over the next day or so, it was quite a big room, really, like the size of it. But at the time, it was, it just seemed really, really small, maybe because of the amount of people who were in there. So that was all kind of all crazy. The HDU nurses were trying to get themselves up to speed with my treatment and where I was and what I'd been taking and all of that sort of stuff. And then it was kind of, then they kind of left and came back, and it was kind of flitting in and out, and they'd ask you questions about how you were feeling, about, one of the questions they ask every 2 minutes is like, can you confirm your name and your date of birth and all this sort of stuff, whenever they're administering medication or taking bloods or they're doing whatever they're doing, and you get absolutely sick and tired of saying your own name and your date of birth. And that was the thing I forgot to mention actually in the ICU video, was that from where they'd damaged the back of my throat with the breathing tube where I was struggling, so I say they damaged, it was probably me struggling. My voice was like really bad, like really squeaky, and like I could barely speak. It was like I lost my voice, and that was purely the damage that had been done with that tube. So it was quite difficult to talk a lot. So I wasn't doing too much talking. There was kind of like just answering questions and stuff. So by the time I was in there, it kind of went quite quick that afternoon, because I'm probably missing out a few things, but I remember them saying that, we're going to try and take you for a walk at like 7 o'clock. I was like, God, I was like only sitting down this morning. Now they're going to try and get me out and about for a walk. But I felt really, really hot over the next hour or so. And I don't know if it was like just everything that had gone on with the surgery and things like that. But I felt really sort of groggy, a bit lightheaded, but just felt like really hot, like I was like sort of overheating or coming down with something. They were taking my temperature, and my temperature was fine, absolutely fine, but I just felt really hot. So they had 2 windows that could open about that much because it's a hospital, and they put a fan on, and it became a standing joke because my room was so cold that the nurses were putting like coats on to come in to do my obs, and I was in there with just a gown on top of the covers because I was so hot. But that was just, I don't know, part of the recovery, part of how my body was dealing with the trauma or whatever. I just felt just so hot. But yeah, that was kind of what I remember. And when they came round to talk about doing a walk, I said, look, I'm definitely not up to it. I said, I'm not even, chickening out. I'm not trying to put this off. I said, I just generally feel like garbage. Obviously, I looked it as well, so they didn't push it. They just said, look, we'll do it in the morning. Let's do something in the morning. We'll let you rest for now and go from there. So that was it. That was Wednesday, like late afternoon, early evening, and I was kind of left to my own devices in the room in terms of they come in every hour, if not more frequent than that, to do, take bloods. They check all your obs. I was on oxygen through the nose. So I had the sort of the nose guard on for the oxygen because my saturation levels were quite low, and I don't think it was anything too serious, but it was almost that because I was still so, I think, dozy. I kind of wasn't breathing as much and as deeply as I was. So obviously they had me on the oxygen, and yeah, that night I don't remember sleeping too much. I didn't sleep much at all in the hospital, so I guarantee I didn't sleep much that night. Um, and again, they kept on saying to me about like pain levels, like they were insisting I press the morphine button because I was in pain. I wasn't complaining, but I was saying when they asked, I said, "Look, I'm probably easy 8 out of 10 for pain." But I was only pressing my morphine button like 2 times an hour. So they were saying to me, "Look, you need to be pressing this more because if you are in pain, we can't tell you're in pain. If you're not pressing the morphine, we can't increase the dose of morphine because you're on like the lowest dose now and you're not even using it." So they kept on trying to encourage me to take it, but it was kind of a vicious cycle really because I would be uncomfortable, not able to sleep in pain. I would take the morphine, press the button, I would doze for about 10 minutes, it would wear off, you come back round, you press it again, and it's just that sort of cycle. So you're not really sleeping, you're just sort of, a morphine induced coma type thing. It wasn't great. You have weird dreams for the 10 minutes that you do kind of pass out, sleep, whatever you want to call it. I had some real hard sleeps in 10 minutes where you're convinced you're not in a hospital anymore, and then you wake up and you're in the ward, on the HDU, and you're like, God, I'm still here. So that was a bit of a, it messed with your mind a bit. So I'm not, as I mentioned before, absolutely not a fan of morphine whatsoever. I don't think it was conducive to me to recover. But it's the painkiller of choice that they use. So it is what it is. So the next day, true to their words, they brought breakfast in. I think I had a spoonful of porridge, and I love porridge. Absolutely love porridge. Hospital porridge is something else. I just absolutely no idea what they make it with. It's so disgusting. It's unreal. The texture, the taste, whatever they do to it, it's not porridge. It's not right. I really don't know what they do to it. I'm not an oat snob. I would buy Tesco's own brand oats and still make a decent porridge out of it. So God knows what the hell they're making this stuff with. And even before, I've done porridge with almond milk, which is quite bland, and it still tasted better than this. So I had one spoon of porridge, and to be fair, I wasn't that hungry. I was really craving like juice, like carton juice, because I needed to drink and I needed something that was more substantial than water. So I was sort of like, drinking those by the gallon. I think I was sort of on the strawberry ribenas, which was the standing joke from previously, because that's what when I was 9, that's all I drank. So it was kind of a bit of a standing joke for the family. They were bringing me up more strawberry ribena. So yeah, true to the words in the HDU, they kind of got me up out of bed first thing after the lovely porridge, in the chair, and then they came round for a wash. So they offered to do the bed bath or chair bath, whatever you want to call it. And I was like, yeah, 100%. Let's, hopefully this might make me feel a bit better. And I'd had that shower on the Tuesday morning. So this is Thursday morning now. So I was like, yeah, let's just do this. So there was 3 female nurses, and when it got to doing certain parts, they just said, look, do you want to do it yourself? I said, I'm not in any fit state to do this. You just crack on. I really don't care right now, like what you can see, can't see, or whatever. I absolutely didn't care. I was in so much pain and discomfort, and and whatever else. You don't even, it doesn't, for me, it did not cross my mind to think this nurse is going to see certain parts. I'm just like, just wash, just get on with whatever you need to get on with, just clean me up and just crack on. I was, not bashful and embarrassed or whatever. It was just a matter of fact. Let's just get this over and done with, and just never speak of this again. But in all fairness, that was it was quite good afterwards. You felt a bit fresh. You had like a new gown on. You had that bed bath, chair bath, whatever you want to call it. And then they took me out for a walk. So I walked with the machines that are on like a big pillar type thing with everything hooked onto it. So your drips and your heparin machines and blood pressures and heart rate monitors. And you kind of got wheels on it, and it's really sturdy. And they use that. You can kind of use it to balance if you want. And you're going around with. So I had two nurses, one in front, one behind, and I kind of just done like a little jaunt down. I probably could have pushed myself a bit more, but I really didn't fancy it. I was just like, no, what's the minute? How far do you want me to walk? And it was to these doors. I got to the doors, and that was it. I was like, no, I'll go back now. That was a target. That's what I'm going to do. No more, no less. And I wasn't going to try and be a hero on my first walk. So I was just happy to just go back, sit in a chair, and relax. Trying to think what else happened. So on the Thursday, so this is the Thursday. So the drains were going to come out, the chest drains. So they were getting you all clear for that to happen. That was all kind of signed off by the docs, so they were happy that they were going to come out. But what they have to do is, because I was on heparin to thin the blood in lieu of warfarin, so I wasn't on the warfarin yet, they had to stop the heparin drip for 2 hours, let the coagulation mechanism kind of reform a bit in the blood, so that when they pull the chest drains, you don't bleed as much. So that was quite a long wait, because you know something's going to happen, you're going to have the chest drains out, and it's going to happen in 2 hours. So you kind of clock watching, and they kind of, for the last bit, they were making sure I was like kind of prepped, ready in bed, laying flat, and all that sort of stuff. And they were the one thing. Well, I remember a lot about my operation in '97, considering how young I was and how long ago it was. I remember a lot. The one thing I remember hurting more than anything were the chest drains. Not so much coming out. I think it's the stitches on the wounds. So I had two chest drains when I was 9. I had 3 this time round, which I was like, I didn't sign up to this. I was mentally prepared for 2, and they've given me 3. But there's a whole different story. So you kind of lying flat, and there's other videos on there of people having theirs done. Luckily, my family hadn't turned up at this point. They were still en route to the hospital. Otherwise, there would be videos probably on there. But it's a quick tug through with the chest drains. They come straight out. The stitches are already in place. They just tighten them up. So as soon as the chest drain comes out, it's tight and tight, and they're pulling. And it's, for me, the belly is like a really sensitive area, anyway, and that sort of tugging and pulling and stuff is really uncomfortable. So we got onto the second one, and you get the second one, you're over halfway, so you just got to have one more to go. Yeah, it wasn't great. I had all 3 out in one sitting. It was uncomfortable. It was a little bit painful, but it's kind of almost like a sliding scale downwards. You've got heart surgery is the worst. The chest drains. So it's everything that's happening. Is one, it's a sign that you're getting better, but 2, the actual pain levels of the things happening are kind of decreasing. They're not so traumatic. So it's kind of a good sliding scale. So I was kind of up and back in the chair not long after. Once they were kind of happy that those wounds weren't bleeding, and then they put some dressing over the top of those stitches. So yeah, they weren't great. They weren't my favourite part. They weren't terrible, but it's it's the course of the the recovery process. You need those taken out. The sign that they're taken out, or the fact they're being taken out, is a good sign that you're recovering well. You know, they'll only take them out when they're happy there's no more fluids left around the heart or any excess blood or bleeding or any internal issues. That's when they authorise them to come out. So they're not going to do it early, and it's kind of a nice milestone in your recovery that they come out. So at that point, I was still left with my central line. So obviously that's that wound there. That's the one big line that goes in. There was another drain there that was taken out at the same time as my chest drains, but that didn't hurt. That was like a needle thing, and that was kind of take a deep breath, hold, and then they pull. That didn't hurt at all. And so I had obviously a central line that kind of was quite a long, it's probably about that long inside into the main artery, and that's where they're drawing bloods, they're giving medication, giving antibiotics, and whatever else through there. I had a heparin drip through a cannula in my left arm. I had, I still had the catheter in at the time for the urine, and I had then the pacing wires as well. So the pacing wires were still in at that point, and they were going to take them out on a different occasion. They didn't want to do it all at the same time. So that was pretty much summed up Thursday. I had family come to visit. They had a lot of problems, the doctors, with my potassium levels. And obviously potassium's like such a crucial part of keeping your heart healthy and in rhythm and all of that. For some reason my potassium levels kept on dropping, so they had to keep putting me on a potassium drip, and there was another drip, I'm not sure what they put me on, for something else that was low, and whether it was the potassium or something else, but when I was on it, I just felt really queasy, really sick, and I wasn't great company. I was kind of sat in the chair, like kind of dozing in and out of sleep, because it just kind of makes you feel really, really ill. Well, it certainly did for me. And I was throughout the time on some sort of anti-sickness meds, but they just stopped them really because a couple of times I was sick in the ICU, but I think that was more down to the sort of movement and anything else rather than actually anything untoward. But that was kind of the medication I was on. So the potassium wasn't great. I was having meals brought to me for lunch and dinners. I didn't eat a thing really. I didn't order, or if I did order, by the time it turned up, I had, me personally, absolutely no appetite. The only thing I did eat was some sweets. So I got my wife to bring some like fizzy sweets, and that was kind of like to take horrible taste away in the mouth. Obviously, it wasn't for nutritional value. It was just kind of to get a bit of sugar. Like I say, I was drinking like Ribena and other like carton juices, and they seemed to like cut through the horrible taste I had in my mouth quite well. So I wasn't really eating, wasn't really drinking, and then that night, so Thursday night was my last night in the HDU, and again it was terrible sleep wise. Just did not sleep, and my attention span was really, really bad as well. So I couldn't even watch anything. So I had my phone, I had my headphones, I had magazines. I couldn't concentrate on anything. I was putting programs on, even stuff I'd seen before that I thought I could just put on and not think about, just watch stuff like for those in the UK, stuff like Only Fools and Horses and things like that it's just kind of easygoing comedy, and I had it on. I couldn't even concentrate with it, and I was turning it off. I was trying to listen to music. That wasn't great. But yeah, that whole night, whole Thursday night was like a really, really, really long night. I was kind of like dozing. You doze for like 20 minutes and it felt like you'd been asleep for hours, and 20 minutes and you've got this big clock on the wall in front of you and you're like, oh great, you're literally counting the seconds, and you've got someone coming in and out all the time as well. You've got a HDU nurse who's checking on you, who's assigned to you throughout the night, taking bloods, doing obs, doing whatever they've got to do. And that just kind of puts you on edge as well a bit, so you're not really sleeping. Um, so yeah, like obviously quality of sleep wasn't great. Um, I was kind of couldn't get comfy at all in a bed. As well, I was kind of like propping it right up. I was going all the way back. I was having the legs up, the legs bent. It's just no matter what you did, or say what I did, I just could not get comfy. Or you found a sort of sweet spot, like I said, for like 5 minutes, and that'll be it. You'd have to move, fidget, do whatever. So yeah, it wasn't great. Kind of woke up. They woke up, but it was kind of like daylight Friday. You don't wake up. It's just it's morning because it's daylight. And there's a change of shift. You've got different nurses in and stuff like that. And they were saying to me, we're going to try and get you on a general ward today. I'm going to try and get you unhooked from some of these things that are left. And then hopefully you'll be able to move around. And also on the Thursday as well, I'd had the not long after the chest drains, I had the catheter removed from the bladder as well, and that was another thing further towards recovery, because you haven't got like a tube coming from your bladder into a box, and it's something else that you kind of have to cart around and move and everything else. So that was good. And then so by Friday, I just had the heparin drip into the left arm, the central line that had, I'm pretty sure it was like 6 taps, 6 different entries coming from it, and the pacing wires coming out of the hole that they had there. So they came out Friday morning. Similar routine, heparin off for 2 hours before, wires pulled out. They actually hurt a bit more, or I wouldn't say hurt. You can feel them. You can feel them coming out. You can feel them on your heart, and you can feel them being tugged down as they're tugging them through the hole. And they done 2 at a time, so it was like 2 sessions, and it was just kind of uncomfortable. It wasn't. It was definitely less painful than the chest drains. So like I was saying, it was kind of like this sliding scale of what they were doing was kind of less and less sort of painful. So by the time that was done, it was maybe 9:30, 10:30 in the morning on a Friday, and they were kind of just prepping me at that point, just getting all my notes and medications ready. I went for another walk that day, quite a big walk, and I felt really good, to be fair. I could have walked a lot further, but again, I was kind of asking, where do you want me to walk up to? What do you need me to walk up to? And then I'll get there and then we're done. I didn't see the point at the time of pushing myself further than I needed to. They had that benchmark that they'll be happy that I get to that stage, then they can send me to the general ward. So I did that, returned back to my bed, and that was fine. So didn't no more, no less. It was kind of for that sort of thing, walking and stuff like that. And that was it. I was kind of waiting around then for most of Friday, and then they were going to stick me back on the general ward. So at the Brompton, I was on the Paul Wood ward, and I kind of got wheeled there Friday afternoon, early afternoon, I think, and I was back in the same bay where it all started on that Monday afternoon, and where I was wheeled out of. So it was quite nice that I was kind of back there. So that was it for my HDU time. There was a lot more that probably went on than I can give credit to, but just the level of care in the ICU and HDU is just second to none. There's someone there all the time. They're always attentive. They're always looking after you. Any sort of questions, anything you need, they're there. They bring it. They don't flinch. They don't bat an eyelid. They just do what they need to do and go from there. The thing I was really worried about was that I was starting to eat. I wasn't eating a lot, really wasn't eating a lot at all. So a mouthful here and there, was going for a number 2. That was one of my big concerns. And they said, look, we can either walk you to a toilet, or we can wheel a commode in, which is basically a wheelchair with a hole and a bucket, as glamorous as that is. So I got them to bring the commode in twice while I was in the HDU. both times complete false alarms, but I think I was more nervous of needing to go than actually going. So that was kind of part of the course. But other than that, that there, whatever you need, the level of care, like I said, was absolutely fantastic. So I can't fault HDU at all, really, and the staff and everything. And the fact I was in my own sort of side room, even though it was like a fridge in there, the nurses hated it because I had it so cold. But is what it is. So yeah, so that's the end of kind of like the HDU periods. Onto the general ward now. So I'll do another video just covering that, and pretty much will bring you up to sort of discharge time.